Good afternoon and welcome. Welcome to the White Coat Ceremony for the MU School of Medicine class of 2016. My name is Dr. Linda Headrick. I am the Senior Associate Dean for Education here at the School of Medicine, and it's going to be my privilege to act as sort of the mistress of ceremonies this afternoon. The first thing I have to do, unfortunately, is bring regrets from our dean, Dr. Robert Churchill. Unfortunately, he's with a family member who's critically ill in St. Louis, and of course, being there is the right place for him to be today. But I bring his regrets, bring his best wishes, and please keep him and his family in your thoughts. So it's a privilege to welcome you. It's a thrill to see so many friends and family here today. The White Coat Ceremony, I'm going to tell you a few words about the ceremony itself. The White Coat Ceremony was first conducted at the College of Physicians and Surgeons of Columbia University in New York City in 1993. It was the brainchild of a physician who was a faculty member there, Dr. Arnold Gold, pediatrician, neurologist, and it was so successful that it spread very rapidly to medical schools all over the United States. The first White Coat Ceremony here at MU was in 1997, so that makes today's event our 16th annual ceremony. As I said, it's been extremely popular, and I think by the end of our time together today, you'll understand why. And to help the students think about and remember the day, you'll have an Arnold Gold Foundation pin on your white coat when you receive it. We think this is important for a number of reasons, but in part it's because we don't want you to think about your first week of medical school or the orientation around your first week of medical school being about pictures and immunizations and lockers and other things you had to do in order to register for school here. Instead, we want you to really think about the first time you put on this white coat, which is an important symbol of the profession. Dr. Gold calls it the profession's coat of compassion. So we want you to remember being here with your classmates, putting that coat on for the first time as a medical student. And then we also want you to remember later in the ceremony when you take a pledge to uphold your profession's honor and carry forward its values of care and compassion. It's my pleasure to introduce some of the people who will be helping with today's ceremony. To my right is Dr. Kimberly Hoffman. Dr. Hoffman is the Associate Dean for Learning Strategies. Next to her is Dr. Jack Gay. Dr. Gay is the Associate Dean for Curricular Improvement. On my left is Dr. Rachel Brown, Associate Dean for Student Programs and Professional Development. We'll introduce our speakers in a few minutes. Also up here on the stage today are three people who have contributed enormously to what I hear has been a very successful orientation week, and I'd like them to stand up and walk over here so everybody can see them. These are student doctors, second-year medical students, student doctors Grace Carlson, Brett Chamberlain, and Kelsey Klostermeyer. Thank you so much for all your efforts. And then finally, I want to recognize the faculty who are behind me on the stage today. It really means a lot to have members of the faculty here to share with the students this important beginning of their journey toward becoming a physician. I've actually had a lot of fun spending a little time with the class of 2016 already, in that I was able to participate in a couple of the orientation activities. We start to get to know one another, to learn about each other's backgrounds, including some of the wonderful variety that this class is bringing to school medicine. We're very excited about that. In doing that work this week, you have started already the process which is going to prepare you to meet and connect with your patients. Making that connection is absolutely key to providing great care. And I promise you some wonderful experiences doing that while you're here in medical school. You'll walk away from those experiences. The patients will feel grateful for what you've done, but you'll walk away thinking, wow, who really benefited the most? Because you'll get so much out of it. One of the innovative educational experiences you'll encounter here at MU is a program that we call Legacy Teacher. It's led by Dr. Betsy Garrett, who's with us on the platform today. During the third year of medical school, the students spend time in a series of intensive clinical experiences. And they meet patient after patient and have amazing stories to tell. We invite the students during that year to pick one patient. It's tough to pick just one, but pick one patient who had a big impact on their learning. And with the patient's permission, the student writes about that experience, and some of the students even produce artwork or photographs or poems to reflect on and share that experience with us. Then in the spring, we host a luncheon to honor those legacy teachers. The purpose of that is to recognize and thank them for the lasting influence that they have had on these young physicians. This spring's Legacy Teacher Luncheon was like so many others that we've had, except that it keeps growing all the time. We completely filled up one of the ballrooms over in the Alumni Center across the street with MU faculty, staff, students, and these patients and their families who came from all over Missouri, accepting our invitation to be part of that and to reconnect with the medical students who nominated them for this recognition. I'll honestly never forget some of the people that I've met in that context. It's quite remarkable, and it's also remarkable seeing them in the context of the relationship with that medical student again. Just this spring, I met a man and his wife who are both hospitalized within a very short period of time with one another, first him and then her. And the medical student who had the great good fortune of being able to care for both of them. So first he was in the hospital with a severe infection of his leg. He went home, was getting better, and then she wound up in the hospital with pneumonia. And the medical student who was involved with their care wrote that she found her perspective changing as she had that experience with that family. Her perspective moved from one of, quote, doctor versus disease to the perspective of, quote, an advocate for the patient, fighting along with the patient to restore them to health and wellness. So from doctor versus disease to an advocate for the patient, fighting alongside with them to restore them for health and wellness. What a thrill to share lunch with them a few months later, back doing their usual things, truly being healthy and well. I met a daughter whose father's mental illness has essentially taken him from her. In fact, his illness was so severe last spring that he couldn't be there. But she decided to come anyway because she wanted to meet this medical student who had made such a connection with her father that the student said, I really learned important lessons from him. That meant an enormous amount to her. And she was gladdened and grateful to learn how much her father had connected with and taught that medical student. And then finally, the third person I want to tell you about, I could stand here and do it all day, but the third person I want to tell you about is an absolutely remarkable young woman who lives in southeast Missouri. She has a really rare disease that causes horrible fragility of her bones. She's lived with it all of her life. She's 28 years old now. She's had multiple fractures, lives with chronic pain. It's caused deformities of her skull, deformities of her mouth and neck, so she can't speak in a way that people can understand. It's caused her to have short stature. She can't even sit in a wheelchair. She gets around in a wheelchair, but it has to be one that props her up at about 20 degrees. But she can communicate through email and through their personal interactions and through that email. Thank goodness for that email. Through that email, they made an important partnership and connection. And I've been privileged to read some of what she wrote. Through that, you see this amazing intelligence, humor, and spirit. And that young woman taught that medical student, and that day me a little bit, about courage in the context of chronic illness. Each patient comes there to be honored because of what they taught a medical student. But every one of those people, when I meet them, tell me how grateful they are for the contributions that a medical student brought to their care. So get ready. You're going to have similar experiences soon. And when you do, you'll know for certain why you're sitting here today. You'll learn firsthand why it's important to learn about where people are and how to go there and partner with them, starting from where they are. You'll learn about who people are and how to honor that, no matter how different they might be from anyone you have ever met before. That's what patient-centered care is all about, and we talk a lot about patient-centered care here at MU. A patient-centered care approach allows us to create the relationships with our patients that are fundamental to great care, and they're core to the joy of medicine. Now that's why we've identified patient-centered care as a focus for your medical education. If you turn to your programs and turn to the page that's just next to the back, it'll say MU 2020 Key Characteristics of Our Graduates. These are the characteristics that we believe that the class of 2016 will need to be successful physicians in the year 2020, which amazingly enough is only 4 years after they graduate from medical school. So this is very real for them. This is our best guess of what you need to be the kind of physicians, the best physicians you can be, providing your patients with the care that they need and deserve. The very first one is about being able to provide effective patient-centered care. That's first for a reason. Everything else is a support for that. So that becomes our sort of organizing framework. And I want to look together at the definition of that. Effective patient-centered care respects individual perspectives, beliefs, values, and cultures. It shares timely, complete, accurate, and understandable information to inform health choices. It engages each person as he or she prefers, understanding that care choices belong to that individual. And it partners in decision-making and the delivery of care. Now, to think a little bit more about this from a medical student's point of view, we've invited fourth-year medical student Audrey Southard to come and share her perspective on all of this. Audrey is from Lawrence, Kansas. She got her undergraduate degree in biomedical engineering at Georgia Institute of Technology. Community service has been a really important part of Audrey's work while she's been here at MU. An example is that she's been an active volunteer and a leader at MedZoo, which is the student-run free clinic here in Columbia. After graduation, Audrey's chosen to train as a pediatrician, and I'm delighted that she plans to do that here at MU. So Audrey, thank you for agreeing to share a few thoughts with the class of 2016.
Thank you, Dr. Headrick. Class of 2016, family, friends, welcome to the University of Missouri. My name's Audrey Southard, and I'm a fourth-year medical student here at Mizzou. I'm honored to have the opportunity to welcome you as you begin this exciting journey. 3 years ago, I was sitting in the same auditorium in my white coat ceremony. If you're anything like me, a lot of thoughts and emotions are going through your heads right now. You might be excited about getting started and nervous about the challenges that lie ahead. Or maybe you're not listening to me talk at all. Instead, you're trying to recall any bit of knowledge that you held onto from your undergraduate biochemistry class. It's okay to be nervous. And yes, medical school will be challenging. But more importantly, you will have tremendous opportunities to learn. And if we accept the challenges that lie ahead, we will become physicians that are equipped to serve those around us. One of the great privileges we have as medical students is the opportunity to take part in the care of real individuals with real concerns. After 3 years of med school, I have too many stories to count about the people I've encountered. Some of these stories are funny, some are sad, but each story is unique, and each patient interaction has been an important part of my education. I'd like to tell you one of these stories. I met this patient, a girl I'm going to call Sarah, on my pediatrics rotation. She was 12 years old, and when I met her and her mother in the hospital room she had just been admitted to, they were both pretty scared. One side of Sarah's face had been hurting for a few days, and she said she had stayed home from school the day before with a fever. She hadn't been to a doctor yet because her family didn't have insurance, and they weren't sure they could pay for an appointment. That morning, though, Sarah's mom noticed that her face had become very swollen, and she decided that Sarah did need to see a doctor. They went to an urgent care clinic, but the nurses there quickly decided she needed a higher level of care. Sarah's blood pressure was extremely elevated, and her blood sugar was 3 times higher than it should have been. Over the next several days, I had the opportunity to follow Sarah's case. I spoke with Sarah and her mom every day, and I discussed her illness with the pediatricians involved in her care. The doctors challenged me to research Sarah's multiple problems, the infection in her face, and also her new diagnoses of diabetes and high blood pressure. The physician I was working with challenged me to explain the science behind our treatments in understandable terms to Sarah and her family, free from any kind of jargon. Moreover, she encouraged me to research and respond to Sarah's mother's concerns about the costs of treatment. Sarah was facing not just an acute problem, one that could be treated and easily moved past, but also 2 new chronic problems, which would require long-term investments of time and money to control. During the first few days of Sarah's hospital stay, most of our conversations were with Sarah's mother, rather than with Sarah herself. When we made our daily rounds, Sarah's mom would ask us questions about tests, treatments, and costs. Meanwhile, Sarah would say hi when we tried to talk to her, and then she would turn her attention back to a book or the television. Similarly, in her daily classes with a talented team of diabetes educators, it was clear that Sarah was overwhelmed and not taking in much of the information that she was presented with. The resident physician on Sarah's case and I spoke about the lack of connection between the healthcare team and Sarah, and we agreed that in order for Sarah to be treated effectively, we needed to help her find a way to become invested in her treatment and care. The next morning, as our team spoke with Sarah and her mom about the latest test results, I noticed that Sarah was holding a notebook with a photo of the pop music group the Jonas Brothers on the cover. "Hey," I said to Sarah, "did you know that Nick Jonas has diabetes too?" "Really?" Sarah replied, her eyes getting big. Then she looked away and went back to watching the muted television. That evening, I stopped by Sarah's room before I headed home, and I asked how her diabetes class went that day. "Fine," she told me. "I learned about insulin pumps, and I learned about giving myself shots. I wonder how Nick Jonas gets his insulin. Do you think he knows how to give himself shots?" Why am I telling you this story? To add pop culture to the growing list of subjects you'll need to study for a successful career in medicine? Or to impress you with my robust knowledge of Disney Channel celebrities? Not exactly. And trust me, I do realize that impressive is not the word that comes to mind for most of you when someone tells you they can recite facts about these popular boy bands. It's okay. I wanted to tell you about Sarah because she's a reminder for me, and hopefully instructive for all of you, about just how much there is to learn. Medicine is more than can be contained in textbooks and journal articles. We are fortunate to have the opportunity to learn from real patients who are generous enough to let us into their very real struggles. Each patient you see will have a medical problem with basic science concepts to learn from, but your education cannot stop at these biomedical facts. We must learn to provide care that's centered on the patient who is seeking help from us. With each patient, we need to step back and ask ourselves, what else is going on? What is going to keep this patient from getting better? Those issues may be related to financial concerns or a lack of social support or anxiety. In Sarah's case, she was overwhelmed by a scary-sounding, life-changing diagnosis. In order for us to effectively treat Sarah's diabetes, we first needed to connect with Sarah. Learning that a celebrity she liked shared her condition enough to encouraged her to invest in learning about diabetes. Each patient is different, but if a barrier to care exists, the scientific facts that we will study so hard cannot effectively be put to use. Becoming a physician is about more than learning to treat diseases. It's about learning to provide effective, complete care to patients who trust us with their health and well-being. Maybe this sounds like a lot to learn. It is a lot to learn. There's a phrase you'll hear frequently in the next few years and throughout your careers, this idea of being a lifelong learner. It's not just a motto. You've already taken classes and had life experiences that will inform your practice as a physician, and your education will not end when you graduate from medical school. The opportunity to be a lifelong learner is a gift, and it's a challenge. Each day, you will be presented with new information, scientific knowledge, cutting-edge research, and patients' individual stories. At times, it will be hard to keep absorbing that information, but keep trying. Learn from the knowledgeable physicians and professors who make time to teach us. Learn from the patients who share their private concerns and fears with you. And learn from each other. You will be surprised how quickly you come to rely on the people around you for insight and support, inside and outside of med school. Don't be afraid to ask questions or ask for help along the way. Today, you officially start on the journey toward becoming physicians. It will be a challenge, but it is such an incredible privilege. Recognize that privilege, even on the hard days, and make the most of it by learning something from each person you encounter along the way. That's my goal for myself. And as you all receive your white coats today, I am so thrilled to have each of you join my classmates and me as you pursue that same goal. Thank you.
Thank you, Audrey. Remember what I said about patient-centeredness? We've just heard another great example. Audrey figured out where Sarah was and met her right there, learning about and respecting what was important to her, even the Jonas Brothers. Audrey shared information in a way that Sarah could use it, engaged with her, and created a partnership that contributed enormously to Sarah's care. The great news is that you too will connect with and learn from the patients who give you the privilege of being part of their care. They will be some of your most important teachers on your way to becoming the MU graduate physicians that we describe here. Now it's my pleasure to introduce Suzanne Potler, whose daughter Christy Kroll is an M4, fourth-year medical student. Is Ms. Potler here? There she is. Ms. Potler is co-president of FAMS, F-A-M-S, that stands for Families Assisting Medical Students. That's another kind of caring that goes on at this medical school. FAMS does a huge amount for our students, like setting up amazing breakfast on exam days, and they've already done some great things for this class during orientation. So Ms. Potler is here to tell us a little bit about FAMS, and I really want to thank you and that organization for all you do for our students.
Yeah, I'm so happy to be here today with all these wonderful people who are going to be our future medical professionals. I met many of you last night at the picnic out at Bethel Park, and I could tell it's just another terrific group of future doctors. So I'm here representing FAMS, which, as you just heard, stands for Families Assisting Medical Students. This organization was formed several years ago by parents who saw a need to provide support and services for medical students. And many of you have received information and maybe the brochure already from FAMS. You might consider FAMS sort of like a PTO for medical school. And I don't know about many of you families, but there are not very many opportunities to get connected when you're students in college. Not many areas to volunteer and to provide support other than, of course, financial, emotional, all of that good family support. But it's been so much fun that these years of medical school that families and myself, my husband, have been able to be involved with the medical students. FAMS is funded only through parent and family donations. We provide funding and volunteers for various medical programs like this week, the breakfast, the picnic, and then throughout the years of medical school there are other programs that are provided. The most costly and volunteer-heavy area, and I believe the most appreciated, is to provide food during 3 days of each of the 4 exam weeks for their first and second years of medical school. I believe the students have already heard about this program because one student told me last night that he is almost already looking forward to exam week so that he can enjoy the good food. I thought, boy, that's pretty impressive. Now, this food doesn't just magically appear for these students, so there are a number of volunteers needed to help provide that. And each medical school class provides the volunteers for their students. So we're going to need a lot of parents to volunteer to help provide both the funding, which would be in the brochure. You'll notice that there's a form in the back, and you can fill it out, and you can mail this in or hand it to me, but mailing in might be easier. And $60, it's a tax-deductible donation. And again, that money all pools together and helps to provide 3 meals during each exam week for their first and second years, and many, many more services throughout their medical school years. Very importantly, on the bottom of the form, there's a place to check if you would like to or if you are able to personally volunteer. I can't tell you how rewarding it is to get to go to those labs and set up the food and have all the, sometimes nervous faces looking at you, and then all the thanks for all the wonderful food and encouragement that we're able to provide. If you have any questions or if you already know that you'd like to volunteer, I'll be at a table afterwards. Also, we'll have a brief meeting on Family Day at 8:30 on August 25th. And I thank you for this opportunity to get to talk to you, and I really encourage parents, if you're available and able, to consider volunteering and help these wonderful people. Thank you.
So thank you, Ms. Poutler, for everything, and for FAMS for everything that you do for our students. As Dr. Headrick already said, I'm Rachel Brown. I'm the Associate Dean for Student Programs and Professional Development. And I do a lot of the things that are to do with support for students outside of the more formal aspects of curriculum and evaluation here. One of the things that I hear a lot is that being a medical student isn't just an individual endeavor. We know as faculty here, and your students know, that they wouldn't have got here if it wasn't for the family support that they have had. So we're grateful to you, and I want to take this opportunity to thank you. Parents, spouses, partners, significant others, siblings, grandparents, aunts, uncles, cousins, children, extended family, friends, support systems, for everything that you've done for our students to get them here. And in advance for everything that you'll do for them whilst they're in medical school in order to help them to succeed. So thank you very much, everybody. You already heard about FAMS. There are a couple of other things I just want to tell you about, and a little word about Family Day. So I'm going to say a word about those 2 things, and also about the FAMS FAMS has a table outside, just outside in the auditorium. If you want to sign up or get more information, talk about it. There's also a table out there from the American Medical Women's Association, and if you want to buy a care package for your student, then during exam week, they'll get like snacks and a nice little card from you offering them support. And that's a week and a time when they have less time to shop and cook for themselves. And then the other thing you may already have heard about, and if you haven't, you'll be getting an invitation about it, is we do a day for families. Family Day this year is August the 25th It's a Saturday. We always do it on a Saturday. It's a chance for you to come find out something about what medical school is actually like, spend a little time with your medical student before they get way so involved that they don't have time to even think. It's from 8:30 in the morning, and we'll have some sessions during the morning, and then there's usually a luncheon for you, and then an opportunity to do a little tour and take a look around the campus and the School of Medicine, spend a bit of time here. So you'll be getting an introduction to that in the next few days. Okay, so now it gives me a great pleasure to introduce Dr. Bert Bachrach, this year's White Coat Ceremony keynote faculty speaker. Dr. Bachrach is a pediatric endocrinologist. He's the Chief of Pediatric Endocrinology and Diabetes in our Department of Health and Associate Professor of Pediatrics at our School of Medicine here at MU. He received his undergraduate degree from Amherst, his MD from St. Louis University, and completed residency and fellowship at Cardinal Glennon Children's Hospital in St. Louis and at Cincinnati Children's Hospital. In his clinical role, Dr. Bachrach sees patients very much like the patient that Audrey talked to you about, patients with endocrine disorders and diabetes. He's the administrative chief of a division that includes endocrinologists, nurses, dietitians, social work, and administrative assistants. His division and the people he works with see patients, and they also do research, both clinical research and basic science research. Besides being an active clinician, Dr. Bachrach is a highly respected educator. He's a scholar and a researcher. He's published more than 50 papers, posters, abstracts, and presentations. One of the really wonderful things about the work that he's done is that he works with our medical students. And so a lot of our students have had their first publication in co-authorship with Dr. Bachrach. He's been a long-standing and conscientious member of one of the most difficult committees and the most demanding committees at the School of Medicine, the Committee on Student Promotions, which has the responsibility for the oversight of the professional development of students and spends a lot of its time working with a small minority of students who struggle for academic, personal, or professional reasons. Bert's received many awards for his educational contributions. I think the ones that are most special are the ones that he's received from our students. He's had rewards for education and student advocacy. He was elected by our students to AOA, the Medical Student Honor Society, and he was nominated for the National Award in Humanism in Medicine. Dr. Bachrach, I'm very grateful to you, and thank you for being willing to be our White Coat Ceremony speaker.
Thank you, Dr. Brown. You should never put me near a microphone. I may never get away from it. Sometimes I break out in a song here. So, and that FAM sounds good. I think I might go back to medical school just so I can take some of those classes and get that food. Prior to speaking, I would like to thank everyone for coming to this important milestone in your respective child's, spouse, sibling, significant other, relative, or friend's life. I would like to especially thank them for no one succeeds without the help and support of those around them. I'd also like to thank Dean Brown, Dean Gay, Dean Hoffman, Dean Headrick, and Dean Churchill for this distinct honor and privilege of speaking to the matriculating class of 2016 as they embark on their journey into medicine. Finally, I'd also like to thank my 12-year-old son, Aiden, for correcting all the grammatical errors in my speech today. When I was asked to speak to you, I pondered, and I again pondered, what is I could say to you to inspire you over your career? Often when I'm asked to speak to students on a personal level is to provide an inspirational or motivational speech. However, what could I say to you today that could have an impact on each individual in the class of 2016 that would lead them to success? I'm quite sure that if not all of you, if not all of you have the ability to surpass all expectations that you have set for yourself. Though the characteristics are listed in your book, I thought I would kind of mention the 8 key characteristics in the MU 2020 mission statement. The 8 key characteristics are able to deliver effective patient-centered care, honest with high ethical standards, knowledgeable in biomedical sciences, evidence-based practice in societal and cultural issues, critical thinker and problem solver, able to communicate with patients and others, able to collaborate with patients and other members of the healthcare team, committed to improving quality and safety, committed to lifelong learning and professional formation, Each of these aspects is extremely important, and there are high expectations for you to achieve these goals over the next 4 years and especially over your lifetime. Often students, residents, and attendings believe that knowledge of biomedical sciences, evidence-based practice, and being a critical problem solver is the yellow brick road, the key to being the ultimate physician. One must remember that knowledge is extremely important for one to succeed. However, there is always a caveat. Medicine today is more than just being exceptionally bright. Knowledge can be gained, it can be lost, and it can change with time. Knowledge can be influenced by politics, albeit governmental policies or medical societies' beliefs. When you have been practicing medicine for a number of years, one begins to realize that the knowledge you have today may be true. However, tomorrow it may be shown to be false, and 20 years from then, again to be found true. However, as a physician, you must abide by using the best evidence-based medicine available to you. You must abide by the characteristic of lifelong learning and professional formation. Now, you may be wondering at this point, as a majority of you are from the state of Missouri, the show me state, and thinking to yourselves, Dr. Bachrach, show me the evidence to back up what you say, for knowledge never changes, politics doesn't influence knowledge, and how can it be lost and how can it be gained? I will go back to one of the first evidence-based trials to show you how these can be true and to show you that one must always be open to skepticism and challenging the current thought process and keeping an open mind. In spite of the knowledge that citrus for greater than 200 years could cure scurvy, and scurvy had been described in the time of Hippocrates, the cure for scurvy in the 1700s was ignored. It wasn't until James Lind, a surgeon in 1747, performed the first clinical trial showing that lemon juice, oranges, could cure scurvy. However, due to the thinking at the time, the fear of humors, the proof was disregarded. The head of the Royal Academy of Physicians supported using malt or barley, which had no beneficial use, for the cure of scurvy. In 1766, Captain James Cook, who circumnavigated the globe on the ship Endeavour, did not lose a single man to scurvy due to the replenishing of fresh fruits during frequent stops along the journey, thus supporting Lind's work. Captain Cook subsequently later had problems in Hawaii, and that's another story for another time. However, the treatment for scurvy was still not implemented until the 1790s. Thus, during the American Revolution, many British soldiers lost their lives to this disease. It wasn't until a gentleman, Gilbert Blane, the chairman of the British Navy Sick and Hurt Board, who finally put Lind's long-ignored prescription to cure scurvy to use during the Napoleonic Wars. The use of citrus allowed for the British Navy to have healthy sailors and help them defeat the French during the Battle of Trafalgar. And what's interesting is you may not think that scurvy didn't cause a lot of problems, but it killed hundreds of thousands of people in that time. Here we have an example of knowledge gained, lost, regained, and the politics affecting the utilization of this knowledge. There are many more examples like this. Dr. John Snow believed the cause of an outbreak in cholera in London in the 1750s was due to contaminated water from the Broad Street pump. Unfortunately, this was counterintuitive to the current theory of humors, and in this case, miasma or bad air, as the true cause of cholera. Dr. Snow convinced the locals to disable the Broad Street pump, thus ending the cholera's epidemic. Interestingly, after the epidemic subsided, government officials replaced the handle, rejecting Snow's theory. Today, the John Snow Society has an annual pump handle lecture in England. The members remove and replace a pump handle to symbolize the continuing challenges and political struggles that reformers face for advances in public health. Yes, these occurred in the 18th century, but there are numerous references over time where issues like this arise. Even in the 21st century and the 20th century, people often believe the current theory of their respective medical society. Something that's near and dear to my heart is an example is the University of Missouri has been the forefront of diabetic care. Robert L. Jackson, MD, the first chair of child health, was an extremely strong advocate for tight diabetic control in the 50s, 60s, 70s, and 80s. His clinical work and data supported the need for tight control. Yet when he would be at meetings advocating this position, he was often laughed at by colleagues and felt to be a pariah. Why, may you ask, did this occur? It was because of a faulty joint study that was published from two major institutions, one in Boston and one in Cincinnati, stating that control did not matter. It did not prevent the complications of diabetes. Thus, the governing body of endocrinology at that time disregarded Dr. Jackson and the advocacy for tight control. However, subsequently in the 1990s, this his forethought and his followers who believed in what Dr. Jackson did, and the Europeans felt a lot more strongly about what Dr. Jackson did than the Americans at that time, led to the Diabetes Control and Complications Trial, which supported what Dr. Jackson advocated, that tight control did prevent the onset of complications of diabetes. Yet it doesn't just stop there. An article in the New Yorker in December 2004 on the bell curve, it talks about a 7-year-old girl, Annie, who was diagnosed with cystic fibrosis. Parents decided that they were going to take her to the best place possible for her care. They chose Cincinnati Children's Hospital due to its fantastic reputation, as well as the fact that they had published a chapter in the premier pediatric textbook, Nelson's, on cystic fibrosis. This is also where the oral polio vaccine was invented by Albert Sabin. Least did they know, the Cystic Fibrosis Foundation for years had been keeping data, and that Cincinnati, in spite of having excellent physicians and leaders in research, only had average outcomes. Thus, Cincinnati did something unprecedented. It coordinated a meeting between the parents and the caregivers and invited Don Berwick, a guru on improving healthcare, to a meeting between parents of cystic fibrosis patients and the doctors of Cincinnati in 2001. This meeting led to an unprecedented effort to improve the quality of care at this institution. Parents were invited to be on hospital committees. Cincinnati doctors also worked to improve the overall quality of the care they provided. Thus, they ventured to the Minnesota Cystic Fibrosis Center at Fairview University Children's Hospital in Minneapolis, which was one of the top 5 institutions in the country for CF outcomes. In fact, one of the key doctors at Cincinnati that was involved in this improvement of quality of care at Cincinnati now heads our pediatric pulmonary department. His name is Jim Acton. What Cincinnati Children's Hospital did was miraculous and supports the goal of what we at our institution constantly seek. One of the key characteristics is the commitment to improving quality and safety. Thus, so far in the address to the incoming class of 2016, we have addressed some of the key characteristics of what is expected to you over the next 4 years. Each characteristic is important in its own right, and there's nothing more important than the quality of care and safety in gaining knowledge and lifelong learning. However, many of you will matriculate to medical school with different backgrounds and abilities. Do not be intimidated by the fact that an individual sitting next to you, behind you, or in front of you may have more knowledge than you when you start your journey. Each of you starts at different levels, and each of you has different strengths. Some of you may have a PhD. Some of you may be former nurses, or some of you may have science degrees such as biochemistry, biology, or pharmacy. Some of you may have parents who are physicians, but many also may be like me, whose parents didn't attend graduate school, nor did they attend college. A majority of you don't have any exposure to the language of medicine. Do not worry, for medicine is a lifelong journey of learning. Each of you has the ability to succeed, and the teaching of medicine today is different, even from when I graduated in 1991. I didn't really understand the practice of medicine until I worked with Dr. David Goldstein here at the University of Missouri. For a long time, I believe my being knowledgeable about everything diabetes and the action of all the various insulin types and knowing how diabetic medications worked were the key to my success as a practitioner. Boy, was I wrong. The first week that I started with the University of Missouri in 2003, I shadowed Dr. Goldstein. The one thing I will always remember is that he had a patient who had a foster child, who was a foster child who had diabetes. He'd been seeing this patient since 3 years of age, and this young man was now 17 years. The patient had been through various foster homes over the years, and this young man absolutely revered Dr. Goldstein, not because he was a physician, but because he looked at him as a surrogate father. I realized in all those years this young man had been in and out of foster homes, the only consistent person in this young man's life was Dr. Goldstein, and that may have happened to you as well. This was a life-changing moment in my career. I began to realize that being a physician was more than just understanding the pathology of diabetes. In addition, I would often become frustrated and angry with my patient for failing to see the importance of good control and preventing the complications of diabetes. Then as my children got older, I started to realize that I would become frustrated and angry at them for their behavior, but yet it never altered their behavior. Thus, I stopped being angry and frustrated at my patients and made a concerted effort for trying to understand who they were and what it could do to motivate them to do better. I became a better physician. I didn't necessarily become a better parent, as I still enjoy yelling at my kids, but I began to modify my practice of medicine. In many ways, this is what the other key characteristics of medicine are, that they will make us better physicians, able to deliver effective patient care, honest with high ethical standards, knowing societal and cultural issues, able to communicate with patients and others, and able to collaborate with patients and other members of the healthcare team. The ability of a physician to understand these characteristics will allow them to integrate this with their knowledge and be an exceptional physician. Thus, I have come to realize that I must integrate my knowledge with the ability to understand my patient. This means I must increase my power of observation. I must query my patient off on topics that may not be comfortable. We'll ask the families what they do for work, what the patient's interests are. Do they have any pets? Do they have any cats or dogs? I often will engage their siblings and patients to get a better understanding of who they are. It's by understanding our patients that one can only become a better physician. I have patients that see me from over 85 different counties in the state of Missouri or Missouri, depending upon what part of the state one is from. And one must be able to communicate with their patients. If your patient doesn't fully understand where you're coming from, and vice versa, there may be miscommunication. One may say that the people of the fine state of Missouri do not differ, but an example of this is one of my colleagues was evaluating a patient who was in the pediatric intensive care unit who was in very serious condition. My colleague was seeing the patient and was very perplexed on why the patients were so positive. And she came to me and was asking me what my advice was because she thought it was very odd. And I asked, because I do outreaches down in Sykeston, and I go up to Kirksville, and I've been up to Hannibal, and I've been down to Southwest Missouri, and I have a big outreach clinic in Southwest Missouri, and for those who don't know, there's white squirrels down in Marionville. But I said to her, I asked, was this family from Southwest Missouri? And she said yes. And I then went on to say that many of my patients in Southwest Missouri have a strong faith in God, and that their faith plays a major role in their health care and healing, and the positive attitude is part of their faith. Now, interestingly, I practice in New England at Eastern Maine Medical Center in Bangor, Maine, as well as at Dartmouth in New Hampshire. Here we had a high French-Canadian population, some who had been intermarried with the Native American population in Canada. I would ask these patients about their family history, and this patient I learned from one of my French-Canadian families is that oftentimes the families, and especially some of the families who have Native American, were reluctant to share their health information, for it was taboo if their relatives spoke of the diseases afflicting them, for they themselves felt that they would come down with the disease. Thus, these are two examples of why one must be cognizant of varying cultures in order to overcome barriers that may lead to physician preconceived notions of the patient or family and to lead to better medical care. Understanding a culture and their life experience is extremely important. If you haven't read The Immortal Life of Henrietta Lacks, and that's for the students and anyone in this room, it's called The Immortal Life of Henrietta Lacks. It should be a requirement for not just medical students, but everyone. This book describes how an African-American woman, Henrietta Lacks, had died from cervical cancer, and her cells, now called the HeLa cells, were preserved and immortal. They were taken without her knowledge. At the time of her death, she had 5 children, but 3 were between the ages of 1 to 4. This family never knew that her mother's cells were immortalized, nor did they profit from these cells. Yet this was a multi-million-dollar industry that led to many important scientific discoveries. But the children and grandchildren of Henrietta Lacks didn't even have the money to afford health care. What this family saw when they learned about the HeLa cells is they saw a vial of these HeLa cells. The youngest children never knew their mother, but that was their mother, Henrietta Lacks. Yet as adults, they only saw this vial that was part of their mother. They felt as if their mother was still alive, and that was their only connection to her, and that the scientists were taking advantage of their mother, and she was immortal, and she was alive. What the scientists saw were just cells. Just cells. That is it. How morally sad. From the Tuskegee syphilis study to the HeLa cells, do we need to wonder why African Americans are skeptical of medical care? We as physicians and scientists often need to look past scientific discoveries and need to be able to humanize our patients, to understand who they are. Eli Wiesel, a Holocaust survivor, stated, "We must not see a person as an abstraction. Instead, we must see in every person a universe with its own secrets, with its own treasures, and with its own source of anguish, and with some measure of triumph." Finally, to touch on the last 2 characteristics, both of which are equally important, we must be honest and ethical patients, yet compassionate. We must be able to say, "I don't know, but I'm going to work my hardest to find out." Sometimes just letting your patients know that you can be wrong or you don't know something allows you to form a more collaborative relationship with the patient and family. We also must collaborate as a team, working together with not only colleagues, but physicians, nurses, and dietitians, pharmacists, administrative assistants, janitors, all in the best interest of patients to succeed. If one thinks that the nurse and the physician alone for care for a patient, they are dead wrong. Think about being in a hospital, and if your hospital isn't being maintained and your janitors aren't cleaning the floors and everything, those people are just as equally important in regards to the care of that patient as I am in making sure I make the right medical decisions. In regards to team, in my department, I hired my nurses, and initially what I did was, and they still talk about it till this day, I will pull up a Mensa test on the computer, and I'll sit there because I want exceptionally bright nurses, and I ask them to kind of go through the word problems. And it's intimidating because I guess I'm intimidating. That's what my kids tell me. And so the goal isn't that they get the correct answer, but what I really want to do is see what their thought process is. Then what I did is I had one nurse, and then when I wanted to hire a second nurse, I would start with that nurse, and I'd ask her to start looking at the Mensa test. And this is kind of what your problem-based learning, which I believe is now going to be called patient problem-based learning and clinical reasoning. Sorry, I probably messed that up, Dr. Hoffman. But I would bring in my my other nurse, and I would just observe, and they thought, this doctor is kind of odd. But what I really wanted to see was I wanted to see how they worked as a team. So I would see, did they ask questions? Did they go work together? It didn't matter whether they got it right, but how did they work as a team? And here I learned how they would act together and they would ask for help. I hired the people who weren't always necessarily right with the answer, but were willing to ask for help. The nurses were willing to seek the right answer and that could collegially get along. And actually, with my dietitians, when we were hiring our new dietitian, she didn't know it, but me and my two dietitians, we stopped up at Hy-Vee to see her in her place of work and talk to her, and we hired her as well. But I tend to hire the best, and I tend to hire people who get along as a team. And I'll match my team against anyone in the country, let alone at this institution. And I'll tell you that top notch. Thus, as you embark on your medical journey, be aware that no man, no woman is an island. Be a team player, collaborate. When you see a colleague struggling, help them succeed. So you may have more knowledge than the person sitting next to you or in back of you or in front of you. But you know what? Without those other 7 characteristics, you won't succeed. You won't succeed unless you work as a team. This is called teamwork. This is problem-based learning. This is called clinical reasoning. And this is what it's all about. In closing, I'd like to sincerely thank you for allowing me to share my thoughts, and hopefully you can be fluent in the 8 characteristics at your graduation. Oftentimes when I sat on the committees for student promotions, I was often asked to give inspirational speeches to students who may be struggling. What I would see in front of me was a student who had unbelievable communication skills, who had compassion, who was able to deliver patient-centered care, was able to collaborate with colleagues and patients, was honest with high ethical standards, was socially and culturally sensitive, but possibly the student was deficient in critical thinking and knowledge. But as long as the student chose to follow the lifelong learning and the professional formation, he or she can become the best. Every inspirational speech I have ever given references Tom Brady. Tom was a 6th-round draft pick of the New England Patriots, who was an average quarterback at Michigan. He subsequently went on to be one of the best professional quarterbacks, the best if you're from Boston. The same can be true for many of you. Some of you may not shine till your 3rd or 4th year of medical school, even when you start residency or in attending. Do not pinhole yourself as not being a good doctor because you are not immediately successful. I don't know if any of you have seen the Katy Perry movie. I've seen it twice, once with my older son, Aiden, and the second time with my younger son, Elliot. And it was actually very good. And what I'm going to tell you is I think you need to ignite the spark and be a firework. Her success actually comes from sheer determination. And I know many of you may laugh, but if you watch that movie, she is very determined to succeed. However, don't be driving on Broadway today on your way trying to think about what you're going to say to the students, and you got Katy Perry playing Firebox or Fireworks, and the Columbia police pull you over and you get a ticket. So, but that's just a lesson. Don't be in your own world when you're kind of doing things. Thus remember, medicine is a journey. Now look around you. Every single person you see in this room, from the deans to the faculty to the staff to your significant others to your friends, parents, physicians, are here to help you succeed. Do not be afraid to ask for their support. Finally, I may never be asked to give the commencement address at any institution, and this matriculation address at the University of Missouri Medical School is most likely the pinnacle of my career. As Tip O'Neill, famous Speaker of the House from Boston, once said, all politics is local. Well, maybe all mentoring is local. If I can motivate only one or two of the class of 2016, maybe they will go on to do great things, if not nationally, at least locally. As John F. Kennedy said, one man can make the difference, and every man should try. I will leave you with his final quote, and this is what Henry Ford said. Some people are destined to succeed, but most are determined to succeed. Classes of 2016, choose the path that you will follow. I will tell you I graduated at the bottom of my class. However, I chose to be determined that I would succeed. Thank you.
Thank you so much, Dr. Bachrach. Now we come to the point in the ceremony where the members of the class of 2016 will be called to the stage one by one and receive their white coat. They'll get their white coats, they'll receive our congratulations, they'll get their pictures taken. It's a wonderful, wonderful moment. It is a very meaningful moment, but it's also a joyful one. And so members of the audience are welcome to do whatever you think is appropriate to help the medical student that or students that you're here to cheer on, to help them remember this, their first white coat. You're also welcome to come down and take pictures if you like, but please be aware of the fact that there'll be a professional photographer here taking pictures, and so there's lots of room, so I'm sure you can sort of work around. So one by one, the class names will be called by Dean Brown, and then you'll all come up and we'll get started. So, Dr. Brown.
So it's a real pleasure and an honor to be the one who gets to read the names of class of 2016 at this white coat ceremony. So let me ask the first row to stand up and please approach the stage. And when you get to the bottom of the steps, I'll call your name and it'll be time for you and each of you to walk on up. So, our first student, Owais Shakir Abdul Kafi. Cecilia Miranda Albers. Yuzon Algalith. Kristen Nicole Alcorn. Thomas Wesley Andrews. Lindsay Beth Bauer. Philip Paul Beck. Anthony Thomas Bell. Matthew James Benage. Derek Allen Benham. Dara Burke. Kevin Michael Bain. Aaron Kenneth Borgmeyer. Crystal Leanne Brady. Matthew Dennis Brighty. Lisa Michelle Brown. Caitlin Marie Brugenhimke. Damon Cody Coyle. Lauren Crawford. Ethan L. Kreider. Ashley Nicole Davidson. Heather Nicole Dijger. Eric David Don Delaney. James Dent. Jenna Diaz. Alyssa Ann Easter. Leslie Ann Farmer. Brady Asa Fleshman. Hannah Catherine Freeland. Brandon Cody Gallimore. Joshua Aaron Geltman. Whitney Diane Goebel. Daniel Nathan Grant. Adam Ray Grumke. Mamdou Sam Hanna. Jennifer Lynn Haslak Minoff. Alison Marie Hungs. Brett Andrew Highschmidt. Jackie Lynn Hersberg. Nicholas Holt Hopkins. Cassie Jean Hyde. Stephen Abraham Johnson. Charles Phillips Jones. Megan O'Reilly Kelly. Philip Michael King. Elizabeth Leone Coney. Megan Michelle Krogman. Benjamin Grant Ladner. Joseph Donald Lammert. Victoria Ann Luvasser. Yelena Levina. Benjamin Tyler Levinson. Elizabeth Faith Long. Teresa Marie Long. Anne Lindley Lottus. Daniel William Lovinger. Trisha Malcolm. Adam Walter Ramdas Maxwell. Patrick Brian Maisie. Sarah May McElroy. Abesalom McConnon. Lauren Abbey Miles. Emily Elizabeth Milford. Awa Mawafik Mohammed. Joseph Andrew Moore. Michael Richard Moore. Nathaniel Gilbert Moulton. Michael Everett Nance. Christopher Ian Newberry. Nathaniel Stewart Nolan. Christopher Brian Norris. Andreas Christopher Plakis. Minna Poppelzee. Patrick John Probst. Stephen Lee Probst. Matthew Joseph Rendo. James Robert Rudloff. Richard Austin Sargent. Alexander Winfield Scott. Kellen Nocky Smith. Trenton James Smolik. Jeffrey Adam Swars. Samuel Franklin Thompson. Andrew Tran. John Scott Underwood. Lila Sarah Wahidi. Alicia Catherine Webb. Justin Dale Waymeyer. Greg Douglas Werner. Ryan Dean White. Robert Ryfort Wiggin. Nicole Marie Williams. Samuel Wyndham. Sydney Young. Yaji Yu. And Dominic Zanaboni. Ladies and gentlemen, MU at School of Medicine, class of 2016. Thank you.
Man, I wish you guys could see what I can see. These guys look awesome. In fact, why don't you guys stand up and turn around so they can see you? And now to what in many ways is the most important part of what we'll do together this afternoon. And that is taking an oath which will officially start you on your journey. When people think about physicians' oaths, most people in the public know about the Hippocratic Oath. But in fact, there are a variety of oaths that have been used in the medical profession over the years. And the one that is well, as long as I've been around here, routinely chosen by the medical school students at MU School of Medicine to take at graduation is the Oath of Geneva. And that's the one that we have here for you today. The values that are addressed here are important values to take on as you receive your MD and join the world as a physician. But they need to be values in action starting now. During your training, throughout all of your time. Now that you have this white coat on, you're joining this profession, and these values are incredibly important. So we've taken the Oath of Geneva, modified it just a little bit to make it be appropriate for a beginning medical student. And that's what I'm going to invite you to take today. To pledge yourself to those values that are so critical to the profession of medicine. The oath is printed in the programs in the middle page, and this is such an important and solemn occasion. I'm going to ask members of the audience and the faculty behind me to stand as the students stand and follow along silently as they take the oath. So please stand. And I'd like the members of the class of 2016 to please repeat after me. At the time of being admitted as a member of the medical profession, I solemnly pledge myself to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude that is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets that are confided in me, even after the patient has died. I will maintain by all means of my power the honor and the noble traditions of the medical profession. My colleagues will be my sisters and brothers. I will not permit consideration of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient.
I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient.
I will maintain the utmost respect for human life. I will not use my medical knowledge to violate human rights and civil liberties, even under threat.
I will not use my medical knowledge to violate human rights and civil liberties, even under threat.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Please be seated. All right, I have one last thing for you to do. In the class of 2016, if you reach into your left lower pocket of your coat, you'll find in there an MU 2020 pin. It's just like the one I'm wearing and being worn by the faculty behind me. I want you to pull it out now and put it on your coat. It'll serve as a reminder of the kind of physician that we want you to become, and will serve as a reminder of our pledge as the faculty to help you do that. Congratulations once again to the class of 2016. That concludes our white coat ceremony. I just have a couple of logistic things to talk about. The class will immediately after the ceremony report to the north side of Jesse Hall, that's the column side, to get their pictures taken as a class with their white coats on. And then I'd like to invite everyone else to join us in the Jesse Hall atrium, right straight back behind the auditorium for a little light refreshment and to have a chance to meet one another and say congratulations to the class. I'd like to say thanks again to Dr. Bachrach, to student Dr. Audrey Southard, and to everyone else who's contributed to this wonderful ceremony. Congratulations again.
Thanks, Josh.